Good morning, everyone.
That's what. Yeah, please start. Please
My
go.
name is Manoj Shettigar. I am presenting on behalf of Dr. Manisha Nanda. She is professor and unit head of Retina in Regional Institute of Ophthalmology, PJMS, Rohtak. Uh, the topic of presentation is role of retinal specialist and smartphone fundus photography in ROCM. Introduction. The in the mucormycosis, in the post-COVID era, in the post-COVID-19 recovery patients, there was a sudden surge of Rhino orbital cerebral mucormycosis cases nationwide due to immunologically and metabolically compromised status. The second most fungal infection was aspergillus. It is an invasive fungal infection that usually occurs in the immunocompromised patients and sometimes presents as an orbital apex syndrome initially. It is rapidly fatal without an early diagnosis and treatment. Aims and objectives: to describe the retinal manifestation and role of retinal specialist and smartphone fundus photography in post COVID-19 ROCM patients in a multi-speciality tertiary care hospital in North India. Material and methods: an analytical observation cross-sectional study was done out in the for initial 20 to 24 patients admitted in the mucormycosis in the tertiary care center Institute of North India. A detailed history examination was done. Thus, fundus images were captured using the 2.2 pan-retinal and 20D lens based on smartphone fundus photography, and contrast enhanced MRI and paranasal orbit and paranasal sinus were done in every patient to see the extent and spread for the planning for the further management. Out of the 224 patients, 176 patients had history of COVID-19 infection in the past. 134 patients had history of hospital stay during COVID-19. 98 patients had oxygen supplementation. 76 had steroid intake. Only 12 patients had taken vaccine against the COVID-19 and none of them were fully vaccinated. The most common age group was between 40 to 60. The predisposing factor, the most common predisposing factors were diabetes mellitus, and there were 121 patients out, and there were 69 patients were newly diagnosed diabetes mellitus patients. Uh, in the major group was in the visual acuity from 624 to 636, and there were PL negative group was from 35, and total number of exentrations were done on 16 patients. Uh, Out of 224 patients of mucormycosis, only 60 patients had retinal manifestations. Fundus findings will not only help in the staging but also in the visual acuity potential of the eye. Therefore, the detailed fundus examination by the retinal specialist must be carried out in every patient. The retinal findings in the ROCM include CRAO happens due to the secondary infiltration or the direct infiltration of the central retinal artery by angioinvasion of fungal infection from in the orbit. It can be combined CRAO and CRVO, disc pallor, optic atrophy, pre-existing diabetic retinopathy. CRAO was the most common retinal manifestation in the patients with orbital mucormycosis. In the study by staging proposed by Dr. Honavar et al., the stage 3, that is stage 3C, central retinal artery comes under stage 3. Also CRAO, CRVO, superior orbital fissure involvement. This is a case 1, 53-year-old male with history of COVID-19 infection 20 days back, presented with the right eye PL positive and PR accurate, pupil with the fixed mid-dilated. There was complete ophthalmoplegia. The smartphone fundus photography done using 2.2 pan-retinal lens. The examination showed diffuse retinal whitening with cherry red spots suggestive of CRAO. MRI showed the right eye proptosis with ill-defined stere hyperintense with fat stranding in intracornal and extracornal compartment. And 5 doses of retrobulbar amphotericin injection was given with IV liposomal amphotericin B. This is a second case. Patient presented with the history of drooping the left eyelid and loss of vision since 2 days. On examination, there were patient had hand movement and PR accurate with complete ophthalmoplegia. There was ptosis and mild proptosis was present. And left eye showed with the 2.2 panretinal lens, there was a diffuse retinal whitening with cherry red spot with perfused macula, uh, suggestive of CRO with patent cilioretinal artery occlusion. Uh, this is the third case, 42-year-old male, history of Covaxin. First dose was given to this patient, and patient was diagnosed with de novo diabetes mellitus. Patient had uncontrolled diabetes. This is a red-free photograph with showing CRO with cherry red spot, and this patient also had tenting on MRI, and this patient was planned for bilateral FES with the left eye exenteration. This is the fourth case, patient 72-year female with the PL negative in the both eyes. The right eye fundus imaging showed CRAO, left eye showed combined vascular occlusion with cherry red spot. For the investigation were done KOH mount, culture, and histopathological examination. This is the fifth case, the 47-year-old female with the 10 years of diabetes history, presented with complete ophthalmoplegia and fixed dilated pupil. The left eye showed complete disc pallor. Um, this is the sixth case. In the sixth case, this imaging media was not clear. It was done in 20 diopter lens. Peripapillary retinal whitening was seen with the disc edema with multiple peripheral fungal colonies, suggestive of mucormycosis. This is the seventh case. The patient presented with extensive facial necrosis and black SR formation in the left face. Patient was advised FES with exenteration and maxillectomy. So the discussion, the pre-existing diseases such as diabetes mellitus, previous history of respiratory pathology, history of immunosuppression, oxygen supplementation, iron overload can predispose to Rhino orbital mucormycosis. So early symptoms include unilateral nasal stuffiness, facial numbness, retroorbital pain, headache, fever. The role of a retinal specialist is we can document the orbital inflammation, muscle involvement, optic nerve involvement, optic sheath, orbital apex, cavernous sinus, and intracranial extent involvement. But the CMRI can't tell the CRAO, CRVO, combined vascular occlusion, disc pallor, and optic atrophy. So we strongly emphasize the fundus examination of every ROCM patient. It not only helps in the categorizing ROCM but also helps in the visual potential of the affected eye. The patient with CRAO and combined vascular occlusion should be considered for exenteration on urgent basis so that the intracranial spread can be prevented and the patient life can be saved. The role of smartphone fundus photography is that despite the availability of fundus camera in our institute, we have to rely on bedside smartphone photography because of the sick immobile patient, and patient were in other wards like ENT medicine or maxillofacial surgery wards. So most of them were immobile, so that and the transportation was difficult and cumbersome. The handy tool was this handy tool was with the short learning curve, not only diagnosing but also documenting the fundus findings, but also monitoring the progression. The patients of ROCM have complete ophthalmoplegia. It's not feasible for them to focus on the target of fundus photography machine. So the smart fundus photography gives an extra edge to document the fundus findings by moving in different direction and focusing the different quadrants. So even though the ROCM has risen from the ashes and affected COVID-19 survivors dramatically by increasing the morbidity and mortality, early diagnosis and timely intervention with multidisciplinary approach is key to its management. To conclude, CMRI with the orbit is an important tool in diagnosing and monitoring of ROCM, but it cannot provide information regarding CRAO, CRVO. The fundus examination of every ROCM patient should be emphasized and should be done with the retina specialist, as it not only helps in categorizing ROCM but also.
Time is up already.
Okay. Smartphone fundus photography can be a handy tool, and with the short learning curve, it will help in the documenting retinal findings. Thank you.
Thanks. Nicely documented cases. The questions from the panel.
Which smartphone fundus photography tool did you use?
Sir, we used a cell phone and 20 diopter.
On your own, you
yes,
were able to focus and do it?
We focused.
So the same person was doing all the photographs? Or?
There were two person like residents were involved in this.
Okay, very well done job.
Sorry, shall I ask?
Yeah, please.
Means I have been doing it for quite some time. This fundus photography, not that easy as it looks, and you need to have a good phone at the same time.
Yes, sir.
You know, and I believe there is not a short learning curve. It has a long learning curve for a very good photograph. Though you have documented very nicely. Good to see all these photographs. But what sir was asking, I particularly want to ask, which software did you use for this? Because you need a constant flashlight for the photograph, isn't it?
Yes, sir. We actually turned on the video.
And
With
the
the flash
flashlight.
on,
And
with
no, every smartphone does not have that function that you have simultaneous video and the flashlight.
Like basic MI.
No, but what I use is a candy cam. So what sir was basically asking, which software did you use for this? I believe sir was asking this.
Sir, regular video apps in the smartphone, sir. Like any other special apps were not used.
Okay, but my smartphone does not have, maybe it's in inferior quality, maybe.
iPhone generally captures the best one compared to any other that we have observed.
Yeah, these were all iPhone photographs.
Just a side question.
Yes,
Did
sir.
you analyze how many of these patients were taking oxygen therapy at home and how many were from the hospital?
Yes, sir. That
Sorry,
was
I missed that.
Yeah, it was included. Wait.
Can you do verbal answering? You can go back now.
Yeah, you can. We
Yeah.
can go on to the next one. You can tell me afterwards.
Yeah,
Thank you.
sure. Okay. Thank you, sir.
Yeah, but nicely documented cases. So it highlights the importance of documentation as well as thorough examination of these patients, which is very important, and most often or not has been missed quite extensively in the practices around. Thank you.